What is a traumatic brain injury? A traumatic brain injury, TBI, is a condition in which the brain sustains damage to the brain tissue as a result of an abrupt trauma or external force. TBIs can range in severity from mild to severe, and they can have different consequences on a person's ability to function physically, mentally, and emotionally. Here are some of the most common causes. Falls. TBIs are most frequently caused by falls, especially in younger and older people. Motor vehicle accidents. Car accidents, motorcycle accidents, and pedestrian accidents can lead to TBIs. Sports-related injuries. Head injuries are possible in contact sports, including football, soccer, and boxing. Assault. Physical attacks, acts of aggression, and gunshot wounds can all cause TBIs. Explosions and blasts. TBIs are possible for both military personnel and those directly involved in an explosion. Objects that penetrate the skull and brain, such as gunshots or shattered bone pieces, can result in severe traumatic brain injuries, TBIs. TBIs come in many forms when diagnosing them. A mild TBI known as a concussion is characterized by momentary unconsciousness, confusion, headache, dizziness, and memory issues. Most people who sustain concussions fully recover. Contusion. A surface-level brain bruise brought on by a direct blow. Coup-contre-coup injury occurs when the force of the impact is so great that it damages the brain on both the side opposite the impact site. Diffuse axonal injury, DAI, is a widespread nerve fiber destruction brought on by the brain's rapid movement within the skull. Penetrating injury. This type of injury happens when something pierces the brain's tissue and causes localized harm to the skull. Typical symptoms of a TBI can have common expressions among people. Headache, lightheadedness, nausea, vomiting, exhaustion, disturbed sleep, sensitivity to light or noise, and balance issues are some of the physical symptoms. Cognitive symptoms include memory issues, concentration issues, sluggish thinking, confusion, and difficulty solving problems. Mood swings, despair, anxiety, impatience, agitation, personality changes, and impulsivity are some emotional and behavioral symptoms. Blurred vision, tinnitus, changes in taste or smell, and sensitivity to sensory stimuli are examples of sensory symptoms. Slurred speech, trouble comprehending or expressing language, difficulty finding words, and other issues with language use and communication. A TBI can have a long and tough road to recovery, but some are treatable depending on the severity and response to treatment. Rest, pain control, and symptom management may be necessary for mild TBI instances. The majority of people recover after a few weeks. For moderate to severe cases, hospitalization, brain injury repair surgery, and extensive rehabilitation may be necessary. Physical treatment, occupational therapy, speech therapy, cognitive therapy, and psychiatric counseling are all possible components of rehabilitation. Depending on the extent of the injury and personal characteristics, recovery varies greatly. While some people fully recover, others endure long-term repercussions. A person's rehabilitation and adaptation to any lasting changes depend heavily on ongoing assistance from medical experts, family, and friends. A TBI can happen to everyone, but there are steps to reduce the chance of obtaining one. When participating in contact sports, riding, skating, skiing, and other activities, use the proper helmet. Always use a seatbelt when traveling in a car. Fall prevention techniques include removing potential hazards, using handrails, installing window guards, and using non-slip mats, particularly for youngsters and older people. Workplace safety. Comply with safety regulations, put on safety equipment, and exercise caution in potentially dangerous work conditions. It's crucial to understand that this information is only a broad review of traumatic brain injuries. Depending on the specifics of each instance, the severity, symptoms, and available treatments can vary greatly. It's critical to get medical assistance for a brain injury if you or someone you know suffers from it to receive an accurate diagnosis and recommendations. I hope you now have a better understanding about traumatic brain injuries. Don't forget to subscribe so you don't miss any new content coming out. Thanks for watching.